Modern medicine defines vertigo broadly as a false sensation of movement, a spatial disorientation where the room appears to spin or tilt. Traditional Chinese medicine, however, separates this sensory failure into two precise clinical concepts: Xuan, which indicates visual instability and lightheadedness, and Yun, which describes a complete loss of orientation and a true spinning sensation. To correct either condition, we first have to understand the baseline mechanics of equilibrium in TCM. Vertical stability relies on a continuous, opposing physical flow. Clear yang must successfully ascend to nourish the head, while turbid elements must remain anchored and flow downward. This animation illustrates that healthy vertical axis. When that axis fails, we look to a foundational classical axiom: without phlegm, there is no vertigo. Without deficiency, there is no vertigo. Clinically, this means spatial disorientation requires two overlapping conditions: a deficiency at the root and an excess disturbance at the branch. When the root fails and the branch becomes disturbed, the head is forced into one of three distinct pathological states. The pathways to the brain either lack flow, leaving the head undernourished; they develop a blockage in the middle region, leaving it obstructed; or they are subjected to erratic upward pressure, leaving the head excessively stirred. But before mapping these states to specific Zongfu organ patterns, there is an absolute clinical boundary. Conservative TCM management cannot begin until acute neurological emergencies are definitively ruled out. This matrix outlines the highest priority red flag symptoms. If a patient presents with vertigo accompanied by sudden paralysis, a facial droop, or any loss of consciousness, this ceases to be a TCM case and requires immediate emergency medical referral. Secondary red flags carry similar weight: a sudden, severe headache, unexplained chest pain, speech difficulty, persistent vomiting, or the onset of entirely new neurological signs all dictate immediate conventional evaluation. Not all vertigo is benign. Excluding these specific red flags is the mandatory first step in clinical practice. Only when stroke, cardiovascular events, and severe neurological traumas are off the table can we begin deconstructing the exact TCM pattern causing the disorientation. We begin with the excessively stirred head, a condition directly tied to the wood element and the liver system. This is an acute issue of pathological upward momentum. Look at this 5-element diagram mapping the water-wood axis. The structural mechanism here starts with liver yin insufficiency. When the water node becomes depleted, it fails to anchor the wood node. Without that anchor, yang escapes its normal boundaries and surges upward as internal wind. This manifests as liver yang rising, one of the most common vertigo patterns in the clinic. The patient experiences a distinct spinning sensation, accompanied by a tight headache, sudden irritability, red eyes, and tinnitus. The internal heat and rising energy are confirmed by the tongue, which presents with noticeably red sides and a thin coating. This is paired with a pulse that feels distinctly wiry, tense, and resistant, like a taut guitar string under the fingers. The treatment protocol for liver yang rising focuses on subduing that upward surge and nourishing the yin. This 3D map highlights the primary acupuncture points: liver 2, liver 3, and kidney 3 on the lower extremities to pull energy downward, paired with large intestine 4, gallbladder 20, and taiyang to clear the head. Needles alone cannot sustain the equilibrium if the patient's routine continues to generate heat. Managing this pattern requires specific lifestyle modifications, primarily reducing anger, managing chronic stress, and eliminating stimulants and alcohol to prevent further liver heat accumulation. If liver yang rising is left unchecked, extreme yang or heat generates a much more severe wood pathology, liver wind stirring internally. The clinical presentation shifts from a manageable spinning sensation to sudden violent vertigo. This extreme internal wind causes physical tremors, numbness in the extremities, and severe tinnitus. This requires an aggressive wind extinguishing point protocol. The practitioner must utilize gallbladder 20, dew 16, liver 3, large intestine 11, and kidney 1 to calm the liver, open the channels, and immediately ground the erratic energy. Wood-based vertigo, whether rising yang or internal wind, is a mechanical problem of excessive upward momentum. The clinical priority is always to rapidly subdue the heat and anchor the energy back into the lower body. The second pathological state is the obstructed head. Here, we shift from the wood element to the earth element, focusing on the spleen's responsibility for fluid transformation. Here, wood overacts on earth. When stress impairs digestion, the spleen fails to process fluids, causing moisture to pool into dampness. Over time, this thickens into a dense phleg obstruction that completely blocks clear yang from ascending to the brain. Phlegm-Damp vertigo feels distinctly different from the chaotic spinning of liver yang. Patients describe a profound, heavy head sensation, as if a wet towel is wrapped tightly around their skull, pulling them downward. Because the root cause is metabolic, the spatial disorientation is accompanied by a foggy mind, physical sluggishness, nausea, and a feeling of oppression in the chest. Palpating the pulse reveals a distinct slippery quality, clearly indicating excess fluid in the vessels. The primary diagnostic confirmation lies on the tongue. It will present with a thick, greasy coating, a direct reflection of the turbid phlegm blocking the middle jowl. The treatment principle relies on clearing the digestive blockage. You must resolve the phlegm, transform the dampness, and harmonize the middle jowl to allow clear yang to rise again. This schematic outlines the point protocol for earth-based vertigo. The anchor point is stomach 40 to aggressively resolve phlegm, deployed alongside spleen 9, Ren 12, stomach 36, pericardium 6, and gallbladder 20 to clear the ascending pathways. Acupuncture must be paired with strict dietary directives. Phlegm-producing inputs like dairy, fried foods, excessive sweets, and alcohol must be eliminated, replaced entirely by warm cooked foods, light soups, barley, and fresh ginger to restart the digestive fire. Earth-based vertigo proves that treating the head directly will fail if the mechanism of injury originates in the gut. The disorientation is merely a symptom of a metabolic blockage in the digestive center. The final pathological state is the undernourished head. This requires evaluating the water element, linking the kidney system to the preservation of marrow and the structural health of the brain. In TCM, the brain is considered the sea of marrow. When a patient suffers from kidney essence deficiency, that deep energetic reservoir fails to nourish the marrow, causing the brain to literally lack the sustenance required to maintain equilibrium. This comparative table illustrates the sharp divide between deficiency and excess. While liver yang presents as an acute, angry, and high-energy disruption, kidney deficiency is a slow, exhausting, and chronic depletion of resources. The symptoms of kidney deficiency include chronic, low-grade dizziness, weakness in the knees, a steady decline in memory, fatigue, and diminished hearing. The tongue will typically appear pale or red, completely lacking a protective coating. Recovery demands a strategy of long-term tonification, essence preservation, and deep rest. The specific point protocol targets kidney 3, kidney 1, bladder 23, dew 20, stomach 36, and Ren 4 to slowly fill the marrow back up. A closely related undernourished state is qi and blood deficiency. This pattern frequently emerges after prolonged illness, childbirth, chronic systemic stress, or sustained poor nutrition. Without sufficient qi and blood to travel upward, the head is left deprived. This causes mild dizziness that noticeably worsens upon standing, accompanied by palpitations, general fatigue, insomnia, and a distinctly pale complexion. The tonification protocol for qi and blood focuses on rebuilding volume and energy. Key points include stomach 36, spleen 6, bladder 20, bladder 17, Ren 6, and dew 20. In practice, these deficiency patterns strongly benefit from moxibustion to introduce warmth and energy directly into the channels. However, clinical safety requires strict boundaries. Moxa is absolutely contraindicated if the vertigo is driven by heat patterns or liver fire. Water and blood pathologies cannot be rushed. Unlike the aggressive clearing techniques used for wood or earth obstructions, treating an undernourished head requires a methodical, steady rebuilding of the body's foundational reserves. By unifying these three pathological states, the stirred, the obstructed, and the undernourished, We form the complete diagnostic framework for vertigo in traditional Chinese medicine. Every presentation of spatial disorientation ultimately traces back to one of three failures: wood generating upward excess, water suffering from downward deficiency, or earth failing to transform and creating stagnation. As the matrix updates, we see the 4 therapeutic targets required to correct these states. The practitioner must clear the obstruction, anchor the rising yang, nourish the deficient root, and restore the harmonious ascent and descent of qi. But the clinical reality is that patients often walk into the clinic highly symptomatic. They are actively spinning, nauseous, and severely unbalanced. In these moments, they require immediate physical stabilization before a long-term differential diagnosis can be mapped out. For this exact scenario, TCM utilizes a general acute protocol. This baseline intervention is designed specifically to rapidly calm internal wind and clear the head, regardless of the underlying root cause. The protocol utilizes a highly specific point combination: gallbladder 20 at the base of the skull, dew 20 at the vertex, pericardium 6 on the wrist, stomach 36 on the lower leg, and liver 3 on the foot. This exact grouping forces the body's fundamental vertical axis to reset. It pulls erratic energy downward away from the brain, while simultaneously clearing the sensory orifices to provide immediate relief from the spinning. To maintain that stability after the patient leaves the table, practitioners rely on auricular adjunct points. Applying ear seeds allows for continuous, low-level stimulation to extend the therapeutic effect. The standard auricular protocol for vertigo targets 5 specific locations: Shenmen to calm the nervous system, the inner ear point for direct local balance, the subcortex to regulate brain signaling, and the kidney and liver points to address the most common systemic roots. The acute protocol will stop the room from spinning, but true clinical resolution requires using that temporary stability as a bridge. The practitioner must identify and treat the underlying 5-element imbalance, whether it's wood, earth, or water, to ensure the equilibrium becomes permanent.